Hi everyone, this is Rick McDermott here with Senior Solutions Group, and we help people understand Medicare, enroll in Medicare. We actually spent quite a bit of time today trying to set up Social Security accounts for our own staffers, and it was not easy. So the reason we do that is to help you make your plan choices easier and get enrolled easier. If you haven't subscribed to our YouTube channel yet already, feel free to subscribe. We'd love to be able to share our new videos with you as they happen, and also feel free to share these with a friend. And so today I'm going to give you another installment of our Washington, D.C. Trip that we took at the beginning of this month. Here we are in March, almost to April in 2023, for the NABIP conference, where we basically lobbied on your behalf on our dime, not on taxpayers' dime. We paid our own way to get back. I paid my own way to get back to DC, all the way from the other Washington, the state of Washington, where we live. So we're excited to talk to you about a session that I attended. In the last several years, I've had a number of different Medicare plans approach me about having us promote their plan. So a lot of people have a lot of information out there about Medicare, and they get confused by all of it. In a nutshell, there's two different ways to get Medicare. When you're on Medicare, A and B, so Part A would be Original Medicare. Your first step is to sign up for Medicare, A and B. So when you turn 65, 3 months prior to your 65th birthday month, if you're on Social Security, you will automatically get a Medicare card in the mail. Then you can choose to accept Medicare or not. If you are still working, you can delay Medicare. So as long as you work, you can stay on your work plan if it makes sense. And then you can delay Medicare, and then when you're ready to retire, that's when we often step in and help people sign up for Medicare Part B to make sure that you're on the plan that you are that's most suitable for you. So there's two different types of Medicare options. Option one on the left would be having Medicare as your bus driver, and the insurance company would be riding shotgun. Or we had a gentleman that came in yesterday that worked at a motorcycle shop here in town. So I use the analogy, Medicare is riding the motorcycle, they're the driver, and then the insurance company would be just riding in the sidecar. So if you have a supplement to Medicare, Medicare calls the shots. It's very black and white. Either it's covered or it's not. And if it's covered, then your supplement will pay the 20% that Medicare doesn't pay, as well as the hospital deductibles, and a lot of the out-of-pocket costs that you would see under regular Medicare vanish. People love that option. It's guaranteed. You can go to any doctor that accepts Medicare. Very simple. You sleep well at night, but you do pay a premium for it. Then you can also add a standalone prescription drug plan, which we highly advise for most people. Or the option on the right side, which we do have clients that have, Medicare Alternative Insurance, also known as Medicare Advantage. Notice I said Medicare Alternative Insurance. It's not Medicare technically. You are disenrolling from Medicare and enrolling in a private health insurance plan. With a private insurance company, your Medicare card actually goes to sleep, goes into hibernation mode. So the insurance company takes the keys of the bus, they're driving the bus, they call the shots. Now they do have to follow the basic rules of Medicare, so they have to cover the same types of care that Medicare covers, but it may be covered differently. The bus driver, which is now the substitute bus driver, they may take a different route than Medicare would take. You might have more prior authorizations. You would have a network of providers that you may have to adhere to. There may be more out-of-pocket costs for hospitals, MRIs, cancer treatment, up until your maximum out-of-pocket, which could be anywhere from $4,000 up to $12,000 per person per year. So the trade-off with Medicare Advantage is you have lower premiums, and you may even get money back on your check. We've seen a lot of market deception. We've seen a lot of misinformation out there. A lot of telemarketers are mucking up the system. Now, there are some good telemarketers out there, but there are some ones that are sharks. So you got to be very, very, very careful. If you do not know who you're talking to and you did not specifically request information from that organization, hang up the phone. I had a gentleman that came in yesterday to say they used his legal name. Let's call him James. And let's say he goes by Ted, not James. So is James Decker available? And Ted, I'm going to call him, said, well, I think James is in jail. Click. He says, I get 2 of these calls every day since I've getting closer to my 65th birthday. So every time I get one of these calls, they ask for James, and I say, I think James is in jail, and it's always click. So be careful if they call you unannounced, you don't know who they are, don't give them any information, don't give them your Medicare number. It can really mess things up. So these Medicare Advantage plans are an alternative to Medicare, and we're at the conference in DC, and Jonathan Bloom, who is the Principal Deputy Director and Chief Operating Officer for CMS, which runs Medicare, gave us a presentation, and we're going to look at bits and pieces of it right now. And I'm going to comment as we go. So here's Mr. Bloom. He's a little dry, but that's okay. It's good information.
25 years ago, that those that chose voluntarily not to receive their Part A, Part B benefits to the fee-for-service program, but through private coverage, that number was close to 5, 6, 7%. And we are at a really change to our programs that more than half of current Medicare beneficiaries who are eligible for Part A and Part B coverage have chosen voluntarily to receive their benefits through a third-party plan. That number is going to grow, and so despite certain policy changes that CMS has proposed, that I'm sure you're hearing about, that we see no change to this curve fundamentally. And so next 5, 6, 7, 10 years, we are planning for the agency to have roughly 60% of those covered by Part A, Part B to choose private plan coverage. So that means several things. That means that we're going to have to think harder for how we think about the choices that beneficiaries have. Today, beneficiaries on average have more than 40 plan choices through the MA program. That doesn't count Medicare coverage, that doesn't count standalone Part D coverage, but those who are thinking about leaving traditional Medicare have roughly 40 plus choices, some much more, some close to 70 different plans. So the feedback that CMS hears is the choice process is getting more and more complicated. And so one very strong policy goal that we have is to do everything that we can by not taking away choices, not changing this curve necessarily, but to make sure that when beneficiaries choose private plan coverage, they are fully aware, they have the choices that are very well explained. But what is true is we have more and more plans coming into the program, and that choice process is getting more and more complicated for beneficiaries. The other second data point that has changed for CMS.
Okay, so when Mr. Bloom, Jonathan Bloom, started out in Washington about 20 years ago, there were about 5 to 6% of people that opted out of private fee-for-service, regular Medicare, original Medicare, A and B, and opted to go to a private plan. And in the next 5 to 10 years, they're projecting, the way things are going with this curve, that up to 60% of people in 10 years will be on a private plan instead of Medicare. Now, a lot of people, when they're on these private plans, they think that they're Medicare supplement plans. They're not. They are replacement plans. They are private plans which replace your Medicare. So we want to make sure that people get the right information, is what he's saying, that they're not marketed these plans incorrectly, overhyped, in other words. There's a couple counties in the state of Ohio. He said some people have 40 to 50 plan options. So in bigger metro areas, you might have 40 to 50 plans to pick from. Some counties, a couple counties in Ohio and one other state, have up to 80 plans. So you can imagine trying to sift through 80 plans to find the right plan for you. It becomes more and more imperative that you find a professional that you can trust to help you navigate through this process. So we're going to skip ahead to the next section here.
Through anecdote, through call center feedback, that we are getting more complaints from beneficiaries who have signed up for coverage that didn't fully understand what they were signing up for. So we track that data carefully by month, by plan, by geography, to really understand what is happening. And so a couple of data points really stand out to us. Complaint volume spikes during the spring. And that's because we think beneficiaries kind of go through the process, they discover there's some friction points, they discover the overall benefit plan they signed up for might not be what they thought it was. And so we can all debate, what the beneficiaries knew choices firsthand, but what is true is that we see spikes. In 2021, that data.
Okay, so what he's saying here is, here you are in the fall, October 15th through December 7th, every fall you can change your plan. So a lot of times people switch to a Medicare Advantage plan not knowing the details. All they hear is, well, you can get money back on your Social Security check. And you get free this, free that, free pet dogs, free, you name it, to try to entice you to maybe a free plan with zero copay for your primary care doctors. And so they're finding when the rubber meets the road, when they actually go to use that plan, they don't understand the plan. They think that they're just adding dental. They don't know that their doctor is maybe no longer in network, or now that they're on Medicare Advantage, that their doctor may not accept that plan. So that's when these friction points happen in the first few months of the year, January, February, March. Then the complaints start rolling in the springtime. So that's what they're seeing. Let's skip to the next section here.
CMS principles are. First principle is the ads going on television need to be clear. Need to be accurate.
The ads going on television need to be clear. Well, Shazam.
Didn't expect that, thank you. Second principle, that we need to really separate what is education and what is sales. Make sure that beneficiaries and that we see the locus or responsibility fall into the plans. They own the relationships to television ads, for example. So we want to hold plans accountable. Those that are growing the fastest, those that have the most marketing complaints, that's where CMS will spend resource to ensure that that overall trend line comes down. So these three principles drive us. And so hopefully that we can agree to these principles.
So what he's saying is these plans that are growing the fastest have the most complaints on average. So it could be a big plan, a big national brand plan, or even a small regional plan. The ones where they're promoting the heck out of them, or it's the latest, greatest plan coming into your area, it's got one or two extra bells and whistles that your plan doesn't have. Those are the plans where they're seeing the most complaints. Let's move on. All that's glittering is not always gold, and it doesn't always provide a better health outcome.
One or two questions?
Yes, absolutely. I have received a few questions back here.
I love that voice.
Sorry, folks, you can deliver
What
those
a great
questions
voice.
to me.
A voice for radio.
The first question I have is, do you think the prevalence of cashback Medicare Advantage plans will grow or decrease?
I think personally that we need to be very careful how we market plans and how we think about the true value proposition for those choosing plans. And so the promise, going back 10, 15, 25 years ago, when Congress authorized different plan choices, that care would be coordinated, that care would be better, that beneficiaries would have access to enhanced benefits. Before Part D was passed, one of the value propositions was that beneficiaries could get access to various drug benefits. If the value proposition is that you can get some money back, that you can get some cash back, then I think it begs two questions. What is the fundamental value that we're trying to promote? I think CMS would argue quite strongly that it needs to be better healthcare benefits, better outcomes, better coverage, better care coordination, better patient experience. And what's the right price tag to the taxpayer? And so if beneficiaries are getting cash rebates back, what are we paying for? And so then we have to ask the question,
what are taxpayers paying for? So are you getting better care because you're getting $75 back on your check each month from the plan? Are you more safer buying a convertible that has a top that goes up versus one that doesn't go up? Are you better off getting bells and whistles, or are you better off getting a plan that's going to do what you want it to do? That's what he's basically saying here. What is the value proposition here?
Next question. What is being done to stop TPMOs from using overseas call centers to cold call seniors?
He didn't answer the question. I think we caught him off guard on this. He seemed quite surprised by that question. So you kind of meandered off on this one. So any of you seniors out there get a call from overseas, that's what people are really complaining about. These overseas call centers is just another way to get their hooks into you.
Thank you. We just have time for a couple more questions here. Are the number of complaints that you have received, are they broken down by source, i.e. telemarketers, personal broker, direct sales, etc.?
I don't believe so, but I can check. They are absolutely broken down by plan. They are absolutely broken down by region. They are absolutely broken down by state. So we can see which plans tend to drive more complaints. We can see which parts of the country tend to drive more complaints, but you can't break it down, I don't think, to that granular level. So, but yeah, thank you.
So what's happening is these complaints that come in, they can only track them to the insurance company. So these insurance companies get all the complaints filed through them, not these bad actors that are out there that are third-party entities. So as a matter of fact, now all agents have to record their calls, in large part because of these bad actors out there spreading misinformation, not giving the facts, not telling people what the plan is. So that's CMS is not even able to track who these bad actors are. So someone in our audience said, you need to change that. We need to figure out who these bad actors are. Yeah, the insurance companies are responsible, but who else is responsible? These predators out there trying to sign people up for a plan by hook or by crook, often because they just want to make a double commission the first year. One last clip.
We have to collectively really talk about the value proposition that's being created for beneficiaries. And so this curve is kind of one statement to that value proposition. Beneficiaries are choosing to leave fee-for-service more and more to seek coverage through private plans. But what is the experience? What is the outcome? What's better for beneficiaries? Do they get better quality care? Do they get better experience? Do they get better member touch? And I think these data points, despite being debated for 15, 20, 25 years, you look at the list.
That's the key. That's the rubber right there where the rubber meets the road. People need to know the pros and the cons. You need to know the pros and the cons of what you're doing. It's not all good, it's not all bad. The data is inconclusive. We're finding a lot of people that are having complicated health conditions, he goes on here, like cancer, are ending up going back to regular Medicare, and there's a reason for that. So yes, more and more people are signing up for Medicare Advantage, but when they get sick, what he's going to say, and we're not going to watch the rest of this, is they're finding more people that have more complicated health issues are going back to regular Medicare. And often, even if they can't even get a Medicare supplement plan, because if you have a complicated health issue, there's a very strong chance you will not be able to qualify for a Medicare supplement plan. So you got to be very careful that you know all the facts, all the details, that you get educated, not sold. There's a right way and a wrong way to do this. Medicare Advantage has some very strong points. It has some good value in many areas. But the truth is somewhere in the middle, and it's inconclusive. So what we really need to do is help our clients, and that's our mission, is to make sure that you're on the right track for you. So if you know all the details, if you know the pros and the cons of both sides, original regular Medicare versus Medicare Advantage, we're going to help direct you and help steer you. And there are other agents like myself that do a good job as well. So if you have an agent that you're working with that you can trust, that's educated, and they're always keeping you updated and informed, reach out to your agent. If you don't have one, reach out to us at seniorsolutions.net or Senior Solutions Group. You can call us at any time, and we'd love to hear from you and hear your stories. We are moved by your stories. They impact us, and they really create a narrative that helps us convey the importance of getting this right. And you only have one time in your lifetime really to get this right. When you turn 65 or when you leave your employer insurance, there may be some do-overs that you may be eligible for, but it's not a guarantee. Reach out to us. We are here for you. We are Senior Solutions Group, and have a great rest of your day.